There is a parasite which can make you more fearless and make you more risk-taking person. This parasite is Toxoplasma gondii, and it is one of the most common parasites in the world. Almost every second person is infected, but most of them will never have symptoms. This parasite is famous for its ability to manipulate the behavior of the host. Usually it's rodents. When they are infected, they become fearless of the cats, and when a cat eats them, the cat also infected. This reaction is not the same in humans, but in humans, Toxoplasma also changes behavior. For example, infected drivers have higher risk of car accidents because the infection slows reflexes. Men also become more rule-breaking because they become less sensitive to punishment or negative consequences. They are also become more suspicious and jealous in relationships, more aggressive, slightly but unnoticeably, and show higher dominance-seeking behavior. Toxoplasma forms tiny cysts in the brain, especially in the amygdala, where emotional regulation happens. These cysts are clusters of bradyzoids, the slow-growing form of parasite. They pass into neural tissue and release chemical substances which reduce neural firing of fair circuit neurons. These cysts also release dopamine-boosting substances related to tyrosine hydroxylase, which is a human dopamine synthesis enzyme. This is why they also increase dopamine level. The cyst itself does not cause strong inflammation. Instead, it creates a very mild chronic local immune reaction. In women, Toxoplasma causes them to become more socially warm. They show higher trust to others, are more emotionally expressive, and show higher conscious, and they show higher social closeness. This happens because of estrogen and dopamine interaction. Increased dopamine in women enhances social cognition, not aggression, but women mount a stronger immune defense. The parasite stimulates cytokines that can increase oxytocin-like effect, leading more pro-social behavior. In most people who become infected with Toxoplasma gondii, there are no symptoms at all because the immune system keeps the parasite in its latent cyst form. Around 80 to 90% of infected individuals never notice anything, and the infection is discovered only through blood tests. When symptoms do appear, they usually resemble mild viral illness. About 20% of cases develop swollen lymph nodes, mild fever, fatigue, or general flu-like symptoms. It may last for several days to several weeks. Only about 1% experience stronger symptoms such as prolonged fatigue or muscle ache. The parasite then becomes silent, forming dormant brain and muscle cysts that can remain for life. These cysts don't destroy brain tissue, which is why infection does not cause dramatic neurological symptoms in healthy people. Toxoplasma in humans is important in three main contexts. The first and most serious is pregnancy, because the primary infection during pregnancy can infect the fetus in about 10 to 80% of cases, depending on the trimester, and can cause brain and eye damage. The second is weakened immunity, such as AIDS or chemotherapy, where latent cysts can reactivate and cause toxoplasmic encephalitis, a life-threatening condition. The third is behavioral effect in healthy adults, which is mild but statistically measurable. The famous fear reduction and risk-taking behavior that occurs strongly in rodents appears in humans only subtly. Based on population studies, about 10 to 15% of infected men and about 5 to 10% of infected women show measurable behavioral changes. These changes are not dramatic and don't turn a cautious person into a reckless one, but they shift behavior enough that large-scale studies can detect patterns such as 20 to 40% higher accident rate in infected drivers. Transmission in humans happens through several everyday routes, and most people acquire the parasite without realizing it. The most common route is eating undercooked meat, especially pork, lamb, or venison, because these animals often carry tissue cysts. In many European countries, more than 50% of human infections come from meat alone. Another major route is contact with cat feces, because cats shed millions of oocysts for a short period of time after infection. These oocysts can survive in soil for more than a year, which is why gardening, touching soil, or eating unwashed vegetables can transmit the parasite. Less commonly, transmission happens through contaminated water or unpasteurized milk. Once inside the human body, the parasite quickly enters intestinal cells, spreads through bloodstream, and forms lifelong cysts in the brain and muscles. The immune system traps the parasite in its latent bradyzoid form within cysts, preventing active replication. This immune control limits inflammation, which protects the brain from damage. That's why more than 80% of infected individuals remain completely asymptomatic. Testing for Toxoplasma is done for specific reasons, not for everyone. The two main situations where testing is crucial is pregnancy and immunosuppression. During pregnancy, doctors check IgG and IgM antibodies to see if the mother had past infection or recent one. If IgG is positive and stable, it means all infection, and it's very low danger for the baby. And if IgM is positive or IgG levels rise rapidly, it suggests recent infection, which requires follow-up and possible treatment to prevent fetal transmission. For healthy adults, routine testing is not necessary because the infection is silent and usually harmless. When a pregnant woman is diagnosed with a recent infection, the first goal is to stop parasite from crossing the placenta. That's why earliest medication is used, pyramicin, an antibiotic that accumulates in the placenta and blocks parasite movement. Pyramicin does not cure infection in the mother, but it reduces the risk of fetal transmission by almost 60%. If tests later show that the fetus is already infected, the treatment changes to a stronger combination, pyrimethamine and sulfadiazine, along with folic acid to protect bone marrow. This combination directly kills rapidly replicating form of parasite and is one of the only effective treatment once fetal infection is confirmed. These drugs are not used in the first trimester because pyrimethamine has teratogenic potential, so pyramicin remains the safest early option. With proper treatment, the severity of congenital toxoplasmosis can be reduced and eye or brain complications may be prevented or minimized. Prevention during pregnancy is much more effective than treatment, which is why every guideline focuses on minimizing exposure. The parasite enters the body through food, soil, or cat-related environment, so pregnant women must reduce these contact points. The most important preventive step is avoid undercooked meat, because this is the main source of infection in many countries. Meat should be cooked until no pink remains. Vegetables and fruits must be washed thoroughly because all cysts survive long in soil. If there is cat at home, the cat itself is usually not a danger, but its litter box. That's why pregnant women should not clean the litter box. If absolutely necessary, gloves and hand washing reduce the risk. Gardening also requires gloves because soil contamination is silent but common root. Freezing meat for several days, avoiding raw milk, and washing hands after touching soil or raw food. We should also remember several things about toxoplasmosis, which is important. Cats get infected mainly through eating infected rodents. So house cats without hunting behavior are much safer and lower risk. Toxoplasma survives in soil and water for extremely long periods. It can remain infective up to 12 months, which explains why gardening is dangerous. Dishwashing and household cleaning kill the parasite easily. All cysts are tough in soil but sensitive to boiling water, bleach, and soap. This is important for home hygiene. Toxoplasma PCR is important in fetal diagnosis. PCR testing of amniotic fluid can confirm fetal infection with high accuracy.